just a couple of things before I start. This really is going to be a whistle-stop tour of everything that has affected this issue. So there will be things I won't be able to include, and it will be so much bigger. But I just wanted to draw on some of the key issues of how pregnant and new families have really been affected by the different restrictions and by just the general anxiety that we've all had over the last couple of years. And linked to that, and obviously very central to that, is how those who care for new families as well have been affected. So the midwives, the health visitors, the doulas, the breastfeeding counsellors, everyone who's been trying to support those families in a completely different way. The second thing, just before I begin, in the introduction there, Sue very much talked about me as a psychologist. I'm talking about this from the perspective of how all the restrictions and the changes and the anxieties impacted upon new parents and those who care for them. I don't at any time feel it's my place to judge whether restrictions should be put in place, measures around the virus. I'm not a epidemiologist, I'm not a health professional, I'm not a virologist, but what I do is spend a lot of time talking to parents and seeing what they're going through. And that is what led me to write the book, COVID Babies. We'd done some research back at the start of the pandemic, so almost 18 months ago now, about new mothers' experiences of breastfeeding their baby during sort of April, May last year. And that highlighted that there are all sorts of issues going on. And then linked to that, we've been doing some student projects and student work around birth and pregnancy and experiences there. And through my social media, I've been talking to so many parents. And it's just clear how affected they have been and how affected many of them carry on feeling, because this hasn't gone away totally. We know that, but in terms of restrictions, it hasn't gone away for everybody. But also those who are sort of emerging from those early baby months are really starting to realise just how much they have been affected by it. So I can't remember who was talking about the quote. I think it was one of the reports, the Babies in Lockdown report, talked about how this was always going to be a long-term issue, because even when hopefully COVID is under control, we're still going to be left with those experiences. So it's thinking about that. So I could go on all evening. I think Sue might get a little bit twitchy if I do. So I'm going to try and pack this into about 20 minutes-ish. I know I've got 30, but, giving myself wiggle room there. Two main things I want to talk about. The first is the impact of the anxiety of being pregnant during this time. And looking back, I don't think there are many of us who haven't been anxious or overwhelmed or stressed during the last 18 months, 2 years. But the level of anxiety and trauma that many pregnant women in particular were feeling, particularly when there were all these debates in the media about whether they were at risk or not. And now you've got articles flying about trying to encourage vaccination, but at the same time causing a lot of anxiety. We know the media really played with all our emotions. We know the media tries to make stories scare us. And the impact of that left so many pregnant women anxious. And some of the statistics are showing that at least 50% of women in some studies were showing clinical levels of anxiety during pregnancy, where you'd usually expect it to be about 10 to 15%. So the same with postnatal depression, which I'll come back to in a bit, but mental health issues, including stress, insomnia, depression, anxiety in pregnancy were about 3 times as high. And that's bad enough in terms of a woman's well-being, the whole family's well-being, worrying about her and the baby. But there were also cases where that anxiety was so strong that we've seen cases in the earlier Embrace reports where women avoided care. They were so scared about going out and seeing a health professional or attending hospital appointments. They were so scared of the virus that they basically didn't access antenatal care at all in some cases, with some absolutely catastrophic issues going on. The stillbirth rate has risen around the world. And one of the reasons why it's been attributed is that the anxiety around seeking care when something is wrong. So we know across the general population that visits to A&E at the start of the pandemic completely plummeted, that hardly anybody was going relatively, and the same with maternity services, that maternity services across the UK and other countries were reporting that they were seeing far fewer women coming in to report things like bleeding or movement slowing. So in cases where they would have usually sought care, they were too worried to do so. And in some cases, that has been attributed to an increase in stillbirth. So one of the key messages around this is just ensuring that when we have public health messages about the importance of staying safe around a virus, it's also emphasising that we really must emphasise the importance of antenatal care too, and that women shouldn't have been in a situation where they were so scared that they felt that they couldn't seek the support they needed for themselves and their baby. So that's the one side of things. And the other side of things has been in terms of the impact of service restrictions upon families. And this has happened around the world. If you go to the research literature now, there are hundreds of studies from all different countries, the US, Canada, Australia, a lot coming out from Italy, particularly when they were in a very severe situation 18 months ago. The impact of different services being stopped for or reduced for pregnancy and birth, and then postnatal services as well. So restrictions around who could attend antenatal appointments, so women having to attend on their own, women having to go into hospital on their own when they were in labour in the first place, and their partner not being allowed to join until later, and then not allowed to stay with them afterwards. There was a very, very distressing paper that came out of Italy that was particularly focusing on women who were diagnosed with COVID-19 right at the start of the pandemic when they were pregnant. And the paper in itself is just heartbreaking to read, because women talked about going into hospital for an antenatal appointment where they were tested for COVID, and they received the news that they were positive, and they were taken away to essentially a secure COVID facility for pregnant women, and they had to remain there until they were no longer positive, or often until they'd given birth. So they'd literally left the house in the morning and not come back, and their partner wasn't allowed to visit. Obviously, no one could come in. And the lasting stress on that in terms of birth trauma is just, I just can't imagine it. It's almost like everything we know about really good care for pregnant and birthing families and new parents had so many restrictions put on it that, of course, we were trying to stop the spread of a virus, and I'm not going to argue with that in any way. But the knock-on impact upon well-being, we're going to see the implications of that for a long time. And the Maternity Campaign was really central then from last summer onwards. It's still fighting some cases and some restrictions, because, of course, we saw the situation then when restrictions around social distancing started to lift for many parts of the population. You know, you could go to your restaurant with 6 people and you can go and watch a football game, and now you can go clubbing. But in some circumstances, you know, you could go clubbing with your doula, but you couldn't go and give birth with your doula because they weren't allowed into the hospital. So it's just really been emphasising that a lot of the restrictions took a long time to lift, and it had a real impact upon pregnant women in particular. This was one of the papers that was published. So it was published last summer, I believe, where they'd done a survey of all the maternity units in the UK and asked whether there had been any reduction or changes in services. And of course, the vast majority reported that yes, there had been some major changes. Big switch was obviously to doing as much as possible over the telephone or video rather than face-to-face, and it's not the same thing. There was there's a report of a maternal death in one of the Embrace reports because a consultation was done over video call, and the person doing it didn't actually realise that the woman was pregnant at the time, because obviously she had the screen up here and she didn't mention it in that appointment, and that was implicated in the death. But we know also that there were so many restrictions. So even things like water birth or home birth was restricted. And of course, we know why it was happening, because there was so much pressure on maternity services. It was because there were fewer staff, there was more cleaning, there was more social distancing going on, which all took time. But then the impact on that upon families' experiences of birth and their mental health. And you have women who were broadly affected in terms of then increased anxiety and birth trauma. But it got to a situation where so many women were reporting that restrictions were being put in place that weren't necessary. So this was a really useful paper that came out towards the start of the pandemic. And thankfully, it did in some cases lead to changes. But what was happening at the start was that a lot of mothers and babies were being separated if the mother or the baby had symptoms of COVID. And the World Health Organization very quickly tried to put out a statement to say that even if a mother had COVID, then because the risk was broadly very, very low to babies, thankfully, that she should be kept with her baby so she could establish breastfeeding, because we knew then that breast milk contained antibodies and we knew that it would help to protect the baby. But there were still so many cases of babies being taken away. And again, it was in that paper from Italy where, and again, it is so distressing to read about sometimes, but there was talking to a study with mothers on the maternity ward. So they were being kept in after the birth. And when the babies were born, they routinely tested them for COVID. And if the baby was COVID positive, somebody would literally walk in and take the baby away from the mother and take them to the neonatal care unit where she wasn't allowed to see them. So the mothers were recounting the stress of it happening to them from someone just walking in and taking their baby away, but also that trauma of seeing it happen to other people. So seeing it happen to the woman that you just made friends with and her baby was taken away, and having to try and console her with all the social distancing going on. There were some really, really awful stories, despite the evidence that they should have been kept together. And we know from a UK perspective that there were real restrictions on a lot of visiting for neonatal care. So we know best practice is that mother and baby should be treated as a dyad. You know, it's really, really important, particularly for breastfeeding, but also for the bonding, the soothing of the baby. It's so important for mother and baby to be kept together as much as possible when the baby is in neonatal care. But there were so many cases in the UK and other countries of mothers having their visits restricted to neonatal care, or even being told that they couldn't go in. And of course, that has such an impact psychologically. In our research that we did with breastfeeding mothers, you know, the mothers who had their babies taken into neonatal care and had their visits restricted, their breastfeeding rates just plummeted, because of course they were so stressed, they weren't able to hold their baby. And it was despite this evidence that the risks of the babies were so low, it was just this precautions, even though they weren't kind of seeing the opposite side. So the impact of depression and anxiety in the separation from their baby. We started then seeing so many different cases popping up and stories in the news. I think some of the most traumatic ones are around women who had to go in for an antenatal scan alone. They were told their partner couldn't be with them, and then they heard the news that they'd miscarried, and they had to recount that over the phone to their partner. Others had to go and have treatment straight away, and of course their partner couldn't come in and visit. All these partners sitting in the car parks trying to support over a phone. And it just, the psychological impact is going to last a long time. Only 23% of NH trusts letting birth partners stay for the whole of labour. That was from towards the start of the pandemic. Most could come in towards the end, but of course, the way we know that labour goes, some were missing it. remember a story of a man in the news who had to drop his pregnant partner at the door, was told to go home, so he went all the way home, suddenly got a call to say that she was about to give birth and to get here as quickly as possible, so he ran back to the ward. But of course, when he got to the ward, he was boiling hot from running and set off the temperature check, so he wasn't allowed in, even though it was from running. And it was the way that these restrictions were just put in place without thinking sometimes in those ways. So babies still being separated, mothers with COVID not being allowed to hold their baby despite those World Health Organization recommendations. We had babies being born in car parks, which had happy endings to them, but there's one of the stories from Italy was from a father who wasn't allowed into the ward, and he talked about trying to support his birthing partner via iPhone. So it was kind of iPhone messaging going on, but somebody just took the phone and put it in the corner of the room, so all he could see was the ceiling and hear her screaming, and was obviously unable to do anything. So the trauma onto birth partners as well. Another father in that study talking about not being allowed in, and the midwife trying to arrange a place where she brought the baby down to a fire door so he could hear his baby crying on the other side of the door, but he wasn't allowed in to see them. And it's just all these stories of separation and trauma without sometimes it being recognised. And a lot of the parents that I've spoken to, particularly over the last couple of months, since we said we were publishing COVID Babies, was that just knowing that the book was out there and it was being recognised in this way was really helping them psychologically, because they felt that because they were healthy and because they weren't personally at high risk of COVID, and they could see these death rates and families being devastated in all sorts of other ways, that they shouldn't say anything, and they shouldn't, as they say, complain. Of course, it's not complaining if you need mental health support, but they just felt that they couldn't talk about it because they felt that people would say, look, you're healthy, you're with your baby, what have you got to complain about? But of course, this impact, we know how much birth trauma and postnatal depression can affect people for a very long time. So, unsurprisingly here, this is just another study. 43% of women in the study showed symptoms of post-traumatic stress after giving birth during the pandemic. We know how devastating birth trauma can be and how long-lasting it can be. But we also know that this is probably a much, much higher figure than we would usually expect to see. It's from the anxiety, it's from the separation, it's from just the whole process of pregnancy and birth and that postnatal period being nothing like you expected it to be, and needing to go along with things because the restrictions were in place for a reason, but also then how that impacts upon new parents. And of course, when you put restrictions in place, they then also have a consequence. So we know that the home birth request rate went up at a rate where some trusts were told that they had to stop doing it because they didn't have enough staff, they didn't have enough resources. They were worried about going out to homes, they were being told that they couldn't do it. So then women who wanted a home birth, we then saw an increase in the rise of free birthing, so women deciding to give birth completely outside the system. In some cases because they were too scared. They were too scared to go into the hospital because they were so anxious about catching COVID and being infected, or they were so worried about their partner not being able to be with them, or so worried about being stuck in the hospital in that way that they felt that free birthing was their safest choice. And we have to just think about how much stress these women must have been going through to feel that they just had to disengage with antenatal care for their perspective to feel safest. And of course, this is an article, very lovely article that was written by Luciana in Glamour magazine that is now online as a website, talking about the rise in postnatal depression. And of course, it is just so high rates and so strong at the moment, with a lot of women really feeling that they cannot speak about it. There has also been a study with fathers. There's only one I could find that was published, and it was all with men. But again, looking at their impact and the rise of depression rates amongst new fathers, often from the perspective that they saw so much trauma happen to their partner, so they couldn't be with her and they couldn't support her in the way they really wanted to. And that having to, one of the fathers in that study talked about his wife having had an emergency cesarean section. She was completely traumatized and hysterical. And then the staff having to say, no, sorry, you've got to go home now. You can't stay. You have to leave your unwell baby. You have to leave your really traumatized wife and go home. We'll contact you. And just the wrench of that and the impact of that upon fathers as well, who are often really left out of this subject. But when we think about postnatal depression, the impact of the birth, but then also that impact of simply having the baby during the pandemic, that loss of the social support around you. I was talking about this morning with some of my students, that it was the way that everything just changed. So particularly for women at the start of the pandemic who were expecting to have a normal postnatal experience, suddenly everything changed for them so much in terms of their family couldn't come around to meet the baby. They couldn't go and meet new mum friends. It was just so completely different experience for them. And it's all the small things as well as the big things. So all the small milestones that mean so much to different families. So the religious ceremonies and the traditions and the meeting up with people, the baby showers, the christenings, the come and meet my baby, it was all gone. And there was just no opportunity to do it apart from on Zoom, which just wasn't the same. I'm starting to lose my voice, I think. So I was thinking about that perspective, but then also that lack of support from a professional's perspective. So they couldn't have so many face-to-face visits. They were short. They couldn't go along to the breastfeeding support group face-to-face. And we know so much good stuff was done online, which really, really helped. But it was never the same as sitting next to another new mum who's absolutely exhausted and unfrazzled alongside you, and just having that absolutely silent connection whilst you both drink tea and cuddle your baby. And this is very much, so this is for the study that we did about breastfeeding right at the start of the pandemic, which really just summed up this. And I should at this point emphasize that this wasn't an awful story for everybody. I think we need to focus on getting the support for the parents who now need it. But I think we also can learn from some of the experiences of those who actually had a slightly more positive time due to their circumstances. So in our research with breastfeeding mothers, we found that their experience often went one of two ways. So they either found it really, really challenging because they couldn't get the support they needed. They felt really isolated. They really just wanted their mum with them, who was a really big breastfeeding advocate. They were struggling perhaps with their partner being a frontline worker and out of the house all day and really stressed at work. And then you had the mums who were actually having a slightly more positive time because they had more time together as a family, they had more time to rest, they had more time to recuperate after the birth and focus on feeding, and they were able to access really good online support. But we knew within that the divide was one of privilege, essentially. So those who are in the most protected circumstances to start with often had the most positive experiences. So they didn't have money worries, and they had lived in a lovely area and they could go out for nice walks, and they had a supportive partner. And one of the big things, they had a really good Wi-Fi connection and lots of devices, and they were more likely to be all right. And then it was the ones who were living in a small flat without a garden, who couldn't access anything, who were having such a more difficult time. And I think that's one of the big things that the pandemic has showed us, that there has been this real divide that has deepened a lot of the inequalities and the real different experience that a lot of us have had. And that was echoed in the Babies in Lockdown report, which is a brilliant report, and I urge anybody to go out and read it if they haven't. And they looked at the experiences of lots and lots of new parents during that first lockdown. And again, it echoes everything I've already said. Parents feeling really anxious, really worried that their baby's behaviour was changing, that they were crying and clingier, not knowing where to get support, but also just this clear data that those in the more deprived circumstances were suffering even more. So they were finding it so much more difficult to navigate all of this. And then just to finish, of course, as I said at the beginning, it's not just parents who have been through this, it is those who have been supporting them as well. So you mentioned the March for Midwives and the midwifery staffing crisis at the moment. It all feeds into the pandemic, and there have been several papers now published about the experiences of midwives trying to care for families through this. And one of the things that really struck me was how much so many of the midwives really suffered psychologically in having to care for these families in a different way. So they knew the evidence around what works best to care for families, and they knew how they usually practiced. And then suddenly all that changed, and there were all these restrictions put in place, and they couldn't care for parents in the way they wanted to. And they were so distressed by that. They wanted to go and hug the mother. They wanted to be with her and close to her as she was giving birth and be able to comfort her. But instead they were told to stay away and to, they just could not get in the same way. And of course, the impacts of just not being able to care in that way, the exhaustion, the staffing issues going on around you, but also often being that frontline person who didn't make the rules and the restrictions and didn't necessarily agree with them, but had to tell the new parents. So it was the midwives who had to tell the new parents that, no, I'm sorry, your partner can't come in. No, sorry, they can't be here at this scan. No, I know you've just had a cesarean section and you're really struggling, but no, your partner can't stay. The abuse that they got from some very, very stressed families, the misunderstanding, but just one of the papers was referring to it as a moral injury because they weren't able to care in the same way. And very similar data came out of the Institute of Health visiting report during COVID. And of course, with this, at the start of the first lockdown, a lot of health visitors were redeployed. So a lot were redeployed into nursing posts, and it left the remainder of the health visitors with such high caseloads. They had all these families that they were trying to support with fewer colleagues around them at a time where they could see families' needs just increasing and increasing. And I think it's in this report, or in a similar one into health visitors' experiences, that so many were seeing they could see a rise in domestic abuse. They were worried about baby development, baby health. They were worried about postnatal depression, and they had fewer resources and time to do it, and weren't allowed into people's homes a lot of the time. So they were trying to do, a postnatal depression check over the phone with a mother that they didn't know very well. And of course, the mother was hiding it because she didn't feel comfortable over the phone. And the health visitors knew that so much was being missed. And again, if they did go into a home, they weren't allowed to sit and be close and spend time just having a cup of tea with somebody and, chatting about how they feel. So again, the impact there, and the message from all of this is we need more investment to pick up the mess of what's happened. We need investment in the midwifery profession, in the health visiting profession, so that they can offer the care and support that so many new parents are now going to need going forward, so that we can support the birth trauma, so we can support the postnatal depression, so we can help families catch up with the, just the baby classes and the having opportunity to get out the house and meet other babies and new parents. And the Babies in Lockdown report, these reports here, it's gone through Parliament as well, just saying we must have this investment. It's absolutely critical, because without it, we're just going to be in an even worse position several years down the line when none of this has been dealt with. So I'm aware I'm probably at half an hour there. Just to finish off with this one, I'm going to squeeze this one in because we have a whole chapter on vaccination and the mess that pregnant women were left in. just as a whistle-stop tour through it, right when the vaccinations first came out, pregnant women were told that they weren't allowed to have it, that it wouldn't be safe and they'd have to wait. And of course, that created real anxiety that it wasn't safe. It wasn't not safe, it was just that pregnant women hadn't been included in the trials and therefore they weren't recommending it at the time. So when the guidelines finally changed so pregnant women could be vaccinated, this anxiety just stayed. And our vaccination rates amongst pregnant women continue to be so low. There continues to be so much misinformation. We had so many cases, and I believe some cases are still happening, where pregnant women have gone to be vaccinated and told that they're not allowed, even though the guidelines clearly state that they did. We had the same issue with breastfeeding mothers as well, but it's resolved itself a little bit better, I think. So again, this is headline news at the moment, and we have to take it back to the step where we talk about concerns and we talk about anxieties and we talk about informed decisions and what's best for a family, because at the moment it seems like some of the press are almost, and I'm not referring to this article, but some of the other articles I saw were basically again blaming pregnant women. Well, why on earth haven't you been vaccinated? When of course so much anxiety was caused and so many barriers were put in their place. So I'm just going to leave you with this subtle image here of this book that might be out next week, available from all good and bad bookshops, and myself on my website.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.